I immigrated from Abu Dhabi 4 years ago with my two sons. Just after 3 months, I was diagnosed with a cancer.
I felt a lump in my left breast. I had my biopsy at Trillium Health Partners, and I remember coming in and I was crying, and I remember going in there and all the people were so wonderful and nice, and it's amazing what someone holding your hand, what that can do for you.
Often, you can think of cancer as this disease in itself that we have to treat, but there's always stories and people and families that are associated, and other diseases that are associated with cancer. And what our program does is leading the way in treating the whole person. And that means all the manifestations of the illness, both psychological and physical, and also the impact it has on the family.
They really encouraged me to discuss everything, since I'm from the background where it's a one-way communication. I was alone with my two sons, and I had no family here. I'm really grateful that they made my journey very smooth.
Cancer affects each and every one of us. It affects our mothers, our fathers, our sisters, our brothers, our friends, our children. This past year, 3,500 new patients were able to get care closer to home at Trillium Health Partners. This is an important set of services that we provide here in our community, close to home.
Cancer Care Ontario has rated this center as one of the top centers in the province, specifically around innovation, around diagnosis, and around wait times.
The Patient and Family Advisory Committee, or PFAC, is a group of patients or family members of patients who have all had cancer. And we don't make a move in the cancer program without their input.
I have a unique role to be a council member. Basic objective is to look from the patient's point of view to make the journey of the patient comfortable and smooth. Since I am from a South Asian background and I was newly immigrated, I had so many different things to share with healthcare providers.
Community support for our hospital is key to our work. With our community, we're able to partner with their time and their financial support in being able to develop new innovative ways to support patients and their families. We're able to test new ideas, work with them on better ways to deliver the care that makes it easier for them at their time when they need us most.
In a diagnostic assessment unit, we bring all of the specialists to one place so that the patient can see them all at one time. For instance, in the breast diagnostic assessment unit, if a woman has an abnormal mammogram, a surgical specialist will see her in conjunction with a radiologist and review all of the films that she may have had. And if she requires a biopsy, we will do it the same day that she's seen by the surgeon. So we've been able to shorten the time between a warning sign or referral and actual therapy by approximately 80%.
Your support will allow us to build and revitalize space for surgical oncology. We currently perform over 3,000 surgeries for cancer at the Trillium Health Partners on an annual basis. That's the second highest volume in the province. We need to build out new ORs to accommodate the growing need and volume, provide greater access to care, reduce wait times, and ensure that we've got a coordinated, patient-centered care approach.
Donor support has been invaluable in the services that we're able to provide for patients in the cancer program.
A new women's imaging center at the Credit Valley Hospital will focus on screening for breast cancer and osteoporosis. It'll be one-stop shopping for mammography, ultrasound, surgical consults, with a diagnostic assessment unit and a full-time radiologist to support our surgeons.
What we are doing, and I credit Dr. Craig McFadden, who's led the way in diagnostic assessment units, is when somebody first has that first concern around cancer, aligning the care so that we're able to take care of that person from the very beginning and get them treatment in the most effective, fastest possible way. And that's our approach to cancer care.
Because of Trillium Health Partners, I'm able to see my children grow up.
We're very fortunate, and we don't want to lose something like this.
We know Trillium Health Partners will always be there for us.
And it's about building something together, and we would not be able to build this without the wonderful community support we enjoy.
Trillium Health Partners saved my life.